All right. So good afternoon again, and so the subject is diagnostics in critical care. So what do you mean by critical care? Yesterday we already had a short discussion, right? What do you mean by critical care? Yes. Can you define what is a critical care means? Archit, where is Archit?
Yes, sir.
Turn on these lights. Your faces I can't see. Turn on the lights. So what is the full form of ICU? Intensive care unit. What we will do in ICU? Thank you. What we will do in ICU?
Treat some critical patients.
Treat the critical ill patients or emergency cases, right? So the subject deals with diagnostics or diagnosing in a critical care. Are we going to do any lab test in the ICU unit?
Yes.
Are we going to do anything in the ICU unit? Archit saying yes. So how can a lab technician assist in a critical care unit in the ICU, Archit?
By taking the blood samples and sensitive area samples for performing cultures.
Very good. So Archit said correctly. So we need to assist in collection of the samples in the emergency unit and also to supervise whether we are getting adequate amount of sample or not. For that purpose, we can assist in this critical care. And what things we might study in critical care? What things we might need to understand? Can you guess without saying syllabus?
We can face
What things are important in critical care? Yes?
Monitoring patients' health.
Okay, very good. So let us write. Monitoring patient vitals. Okay? Monitoring patient vitals. I hope you know what is the meaning of vitals, right? What is the meaning of vitals? Huh?
Sign and symptoms.
Not sign and symptoms. Vital signatures, the signs of being alive. Pulse rate, heart rate, blood pressure, breathe rate, respiratory,
oxygen level,
consciousness, oxygen level, all these things are vitals. So obviously we need to monitor the vitals of the patients. Next one. What else we will do? Current, watch the code, okay, not mobile. What else we need to consider in a critical care unit in the ICU?
Sir, according to lab technician, we can check for the environment samples like.
Of course, the sample collection supervising, that I agree. Next.
Sensitivity check.
Sensitivity check. In what aspect, Archit?
Sir, because during my diploma time, when I pursued my training in ICU, we used to collect the samples of floor, walls to check the sensitivity and perform the cultures.
Okay, I agree with Archit, but why are you saying sensitivity? Can you define sensitivity? Because I don't know.
Sir, because in ICU it is already an intensive caring unit, so the environment should be more compatible for the
I
patient.
understood. As Archit said, correct, but sensitivity means there is another term, another concept called as sensitivity testing, anaphylactic reactions, immunity. I thought you were saying that.
No.
Anyway, very good. See, ICU is a place where critically ill patients came to the department. That means the chance of death is high in these patients, right? In this aspect, imagine we got an AIDS patient, already severely immunodeficient patient. Unfortunately, he came to this ICU unit. And imagine, in this environment, there are pathogens. And in AIDS case, a simple sneezing virus can kill him. A simple cold virus can kill the patient. So, maintaining the sterility of the room environment is very important. The room must be sterile. Maintaining sterile room was very important in ICU. If not, patients will die due to cross infections. Such infections are called as nosocomial infections, right? Nosocomial infections. Nosocomial infections are hospital-acquired infections or hospital-borne infections, right? Now, how do we need to check the sterility of the operation theatre or sterility of the ICU. How we will check? Apart from urgent others, how to check the sterility of a ICU? Yes. Think in realistic way. How do we check sterility in the ICU? So what we will do? We will take random samples of the room, not the patient. We will, what are the areas where there is a high chance of catching an infection in a room? When you are opening the door handles. So we need to take the sample of the door handle, whether the door handles are sterile or not. Then any second one?
So the floor sample and wall sample.
Floor samples. Okay. That is why when you see, unfortunate cases, if our beloved people are in ICU, we have seen that we can't walk directly into ICU. We need to wear all apron, gloves, even socks, or at least they will give covers to wear as a shoe covers, right? So yes, obviously we need to take the floor sample. Next, what other samples we can collect?
Sir, the patient test sample.
So patient bed samples, whatever patient touched in the room, his bed, his pillows, his sheets, even the utensils used by the patient. Okay, whatever utensils, right? So those things need to be checked. And what other samples we can take or check?
Partition curtain samples like.
Yeah, partition curtain samples. Okay, room dividing curtain samples. So by this you have understood that here we are collecting samples of the environment to check the sterile condition, how sterile their room was, right? So for that purpose, that aspect we will do in ICU. What other things we can do in the ICU? What other things we need to monitor in the ICU? Of course, biomedical waste management, right? Since patients will come with amputated patients also. Suddenly, a person met with an accident and he's coming with heavy bleeding. Sometimes, even hand might be amputated. So definitely there will be more biopsy or tissue samples, and we need to discard them appropriately. So biomedical waste we need to manage. What other things? Yes. What other things we can monitor in the ICU unit?
Sterilization and sanitization in ICU.
Yeah, sanitization protocols, right? So here we can say that sterilization, checking the sterilization, this is the checking aspect. Another one, actually doing the sterilization. So, is it possible to autoclave complete room?
Yes.
Is it possible? So, Kushit thinking very well. Kushit, who said yes? No? Kushit.
Fumigation.
Very good. You said the correct answer. We cannot keep room in an autoclave, but we can fumigate the room. What is the meaning of fumigation? Can anyone answer apart from Geeta?
Yes.
Sir, the proper way.
What is fumigation? How we will do fumigation? Any idea? Yes, whatever you know, you can
Proper
inform.
airflow and ventilation into the ICU.
Proper airflow and ventilation is a different aspect. That is not fumigation.
Sir, but it can be a part of fumigation.
Yes, Muskan. Through gases. Anyone? Smoke. Yeah, ideally it is like, the best approach will be, as Geeta said, fumigation means it's a type of smoke, or you can say moisture. During nebulizer, we will get a vapor, right? So we will expose this formaldehyde vapors. Formaldehyde will be converted to gas, and that will be forwarded into formaldehyde, and that will be exposed to the room. And formaldehyde is one of the potent cell membrane destroyer. Cell membranes will be easily destroyed by formaldehyde. That means formaldehyde is a carcinogen to humans. If you inhale formaldehyde vapors, there is a chance of getting lung cancers in future. So you need to be very cautious. If a room was in fumigation process, you should not open the room and you should not roam in that room. Okay. It is a very powerful gas that it can, it will expand each and every corner of the room, and it will sterilize the room. That process is called as fumigation, right? Fumigation, you understood. What other things we can do? ICU unit. So here I am writing fumigation and all sterile checks. Okay, autoclaving, hot air oven, everything we will check. Next, what other aspects we can see in ICU? Yeah. Now listen. As Archit said previous statement, see the room must be laminar ventilated. The room should have a laminar airflow. What is the meaning of laminar airflow? Any idea? Unidirectional airflow. What is the meaning of unidirectional airflow? Only in one direction. Okay. So ideally, these rooms are designed in such a way that there will be two, these filters or these coolers. One cooler will emit the air. Air will come here, and this cooler will be a exhaust fan. So that will discard the air. So automatically there will be a proper laminar flow in the room. So this is not as easy as this. There is a, the equipment is very costly, and they will maintain this laminar flow. What is the purpose of laminar flow? To see whatever pathogens are releasing, they will be discarded outside without scattering in the room. Just like you were culturing laminar food, we have, right? And now listen, very important. Since we are maintaining laminar flow in the room, is okay. But so are we going to discard these microbes into the environment outside? Is it ideal to do like that? Then how can we sterile the air before filtering it out, before sending it outside?
Setting up an autoclaving machine or something.
Autoclaving, yeah, listen. That's why we have something called HEPA. Do you know what is HEPA means? What is the full form of HEPA? High efficiency particulated air filters. What is this? Simple. Just like the way we are keeping mask, to this ventilator we will keep a filter, a mask. Okay? So once this air going through the filter, it will filter out the particles. So it will be trapped in the filter. Then we can discard it. So this is very important. HEPA filters will be maintained in these ICUs. Very important. It is because of HEPA filters we are able to enter inside the room actually. Even with covers on the shoes, we are entering because the dust will be floated away unidirectionally. So that is the reason. Yeah. Next one. What other things we can do? Tell me. Any other things? Checking biohazards. What do you mean by biohazards? Checking the biohazards, things that will harm the patient. Can you more define it?
So like cancer patients are more sensitive. Exposure.
So potential harmful exposures you are trying to say, right? Potential harmful exposures by the patient. Okay, I agree that is a good statement. What are those potential harmful things then in your case? What you are trying to draw? What things can kill a patient in the ICU? Germ, very good. Pushy and Muskan. So you are saying that there might be germs, but that's why we have kept a fumigation, and that's why we kept a laminar flow, and that's why we are doing sterile checks every day. And what else can contribute there? If this we already do it.
Staff contribution.
Staff, very good. The appropriate behavior of the staff, the PPE, as our Archit said previously. Archit becomes smartest guy there nowadays. Good. Alright. So proper PPE protocols and good ICU practices we can say, right? You should not touch the patient, you should wear the PPE in a right manner. Do you remember how to wear a PPE, the steps of wearing PPE? What is the first thing we will wear during the PPE? Yes?
Head mask.
Head mask, gloves.
Gloves.
Head mask. Gloves. Gloves should be the last thing to wear.
Face mask.
First face mask, okay? You will wash your hands, then face mask, head mask, goggles, then apron, and if you already have shoes, that's fine. If not, that will be first. Then after head, face mask. Then last and final. First, before wearing the gloves, you will wash your hands again because you touched all your body. Then you will wear your damp, sterile, clean hand gloves. Then you will start operating in the ICU. Okay. Usually what you will do, you will wear gloves and you will start wearing all other things. You contaminated the gloves already. The concept of sterility gone. Yeah. So that is called donning, wearing of PPM. Removing of PP is called as doffing, right? Yeah, donning means wearing and doffing means removal. How to remove a PP, What are the steps?
Gloves, sir. First gloves.
Huh?
Gloves.
Yes. First you remove the gloves. Then wash the hands. Then
Head marks.
yeah, okay, head mask, then goggles, apron, and last thing should be your
Mask.
face mask. Right? Yeah, very good. So donning and doffing procedures need to be strictly followed, and these good ICU practices should be followed. Don't touch anything, all these things. Very good. Then what is other aspects we can check in ICU then?
Properties of chemicals that is being used, sir, of chemicals which is being used in mopping.
So chemicals used in mopping. Also, what you are trying to?
First we start at ICU का सर mopping normal नहीं होती ना.
Okay. Of course, we will use more authentic, approved chemicals in the ICU. We cannot use normal Lysol Dettol. There are some approved agents that only we should be used. That is a auto-sterilization procedure. Any other things we will check in ICU? If you don't know, there is one most challenging thing in the ICU, that is drug-resistant microbes. Multi-drug resistant microbes. Very, 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 very challenging to control. Very challenging. I think when I went my hometown last 2 weeks ago, I met one of my friends. In my city, Vijayawada, there is one famous hospital where I was born, American Hospital. So, recently, 1,200 post-pregnant women died. The mother's fatality rate was high, mortality rate, okay? Fetus and mother both are dying after giving birth. Okay? It became a very serious concern. Just a second. I think I cannot record some things. Yeah. So, nothing happened in Vijayawada, by the way. Yes. Yes.
Sir, the dietary of ICU patients. It should be separate and
very good. Well done. Everyone appreciate Archie first of all. Well done. ICU diet is entirely different from normal diet. They have a special sterilized diet. Ideally we won't give any food to them. Directly banana, apple, we won't give them. No, we will maximum try to keep intubations only. The surprising I learned when I was in one hospital, I thought that food will be given through the oral, what is this called as? Not esophagus, in the pharynx, the oropharynx. Okay? Through oropharynx, the tube should go to the esophagus, right? But that is not the way of giving food to the patient. They will give through nasogastric route. They will go through the nose. We thought nose tube is for breathing, but they are bypassing it to the esophagus. Why they are doing this approach? Can anyone guess? Why not they are directly going through oral route? Why they are going through nasal route?
Sir, because in some of the cases in ICU patients they have shortage of breath, so mouth passes can be used as a
very good. See, there is a chance of blocking of choking. There is a chance of choking if you are keeping wide pipes in the
Yes, sir,
catheters
but from
in
the nasal passages it can be
from nasal it can be bypassed.
Suction.
So the wall will be opened. The tracheal tracheal wall will be, epiglottis will be opened wide. Okay. So that is the idea. So nasogastric is the best route for giving food to the patient. Yeah. Next one. What else we will do in the ICU? You given many points so far. Diet is one important.
Coverage of
Diet
human waste.
management. Then
Proper discardation of human waste.
yeah, that is part of BMW, biomedical waste management.
Sir, patient's waste.
Excreta. Obviously, right? Patient's urine and excreta should be separately discarded properly for collecting. Yeah. Anything else?
सर आईसीयू में मतलब प्रॉपर सैनिटाइजेशन वगैरह रहती है, पर जब पेशेंट एक बेड पे लेट जाए आईसीयू में तो उसके बाद उसके जो पिलो कवर्स हैं और जो शीट्स वगैरह वो कैसे चेंज होगी? इट शुड बी अ पार्ट ऑफ इट. सर बेड शीट्स पिलो कवर्स शुड बी चेंज्ड रेगुलरली.
Yes. From patient to patient they will remove. They won't use same bed sheets, never.
On the next day, like.
Yeah. See, that's
For the
what-
same patient.
You are saying for the same patient?
Yes.
Are they? Yes, they will change. They will change. There is a strict these rules actually. Every day they will change the bed sheets.
Sir.
How they change?
How
So
they
if the
change?
patient is not in a condition to move,
Move.
and how they
We have a specialized movable stretchers, movable. We can do it. We can. There is a procedures, protocols are there. You know those beds are those beds can be movable, bendable. If you see it. Possible. That's possible. See, you start with training now. Eric, what else we will go check? Now listen. Class enough. This class is till 12,
12.
15.
1 o'clock.
Yeah, 1 o'clock. Then I have sufficient time. Listen now. Apart from the vitals measuring of the patient in the ICU, one of the serial killer that will keep the patient in deteriorating state is metabolic waste products. The patient not eating properly and things